Thank you, and good morning, everyone. Um, I'm Dr. Marisela Cervantes, chair of the committee, alongside Dr. Phillips and Dr. Kasuga. Dr. Kasuga is here, so we have a quorum, and we'll go ahead and get our meeting started. Welcome back to those of us who have been with us all year. I'm sorry, I didn't formally say I was calling the meeting to order at 10:07. Well, welcome back to everyone who's been following us. This is the second of two committee meetings for the year to review and discuss active legislation for 2024 and to review the status of regulatory packages approved by the board. By way of housekeeping, we are going to um, do two time checks, one at 11 and one at noon, to determine when we will take some breaks. And we will break for lunch at 12:30. Okay. Before moving on, I want to make sure to have an opportunity that we call the roll.
Suga.
Here.
Cervantes.
Here.
Phillips. Roll is complete. Thank you.
Thank you. Ms. Whitney, do you have an announcement about CPD for today?
I do. Thank you, Dr. Cervantes. By attending today's Legislative and Regulatory Affairs Committee meeting provides you with CPD credit under category number 1, attendance at a California Board of Psychology meeting. It will also count towards credit for the law and ethics requirements. For your CPD records, please notate today's date as June 14th, 2024, and note that we are here for the Legislative and Regulatory Affairs Committee meeting. At the end of the meeting, I will be announcing how many hours you can be credited. If you called into the meeting, please email bopca.dca.ca.gov with your name, license number, and the phone number you used to call in. If you signed in using the computer or mobile device and you see your name clearly in how you're logged in, your attendance will automatically be documented and you do not need to email Bob. Back to you, Madam Chair.
Thank you. Before we get started with item number 3 on the agenda, Dr. Kasuga, can you turn on your camera?
I'm trying to. There we go. Is it open now?
Yep, we
Okay.
see you.
Okay.
Okay.
Unfortunately, I have to do it on my phone because my laptop, my DCA laptop, isn't letting me do it. So I apologize for the format.
No problem. We're happy to see you. Okay, I think we are good. We are all in compliance. We did all our housekeeping, so we can get to business. Item number 3 is public comment for items not on the agenda. Note that the committee may not discuss or take action on any matter raised during the public comment section, except to decide whether to place the matter on the agenda of a future meeting. This is per Government Code sections 11125 and 11125.7a. Is there any comments from the committee or the staff on this? Seeing none, let's go ahead and open public comment for item number 3.
This is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment for items not on the agenda, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. All right, and it looks like we have a couple hands raised, so I'm going to go in the order they are received. First, I have John Peterson, and John, it looks like maybe you might be connected with a different audio. Can you press *3 on your audio device so I can unmute your microphone for your audio? Or if you'd like to type your comment in the Q&A box, that works as well. All right, so while we wait for John, I'll just keep going down our list. Next I have Sean McCall. Sean, you'll be given 2 minutes to speak with a 30-second warning. Please click the unmute me button when the prompt appears on your device. All right, and you are unmuted.
Yes, ma'am. So I'm a psychologist here for the continuing education units.
Thank you for joining us.
You're welcome. Glad to be here.
All right, and so our next commenter for public comment for items not on the agenda, Sandra Stein. Sandra, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Ms. Stein?
This is the moderator. Ms. Stein, you'll want to click the unmute me button when the prompt shows up on your device if you'd like to make a comment for items not on the agenda. If not, if I can ask you to lower your hand. All right, and you are unmuted.
I didn't mean to raise my hand. I can't quite figure out how this works.
All right, it looks like your hand's lowered now, so if you don't
Okay,
have any
sorry
comments,
about that.
no worries.
No.
Thank you. All right, this is the moderator. Next we have an individual logged in as 477-171. 592. You'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device. All right, and you are unmuted. Oh, it looks like you remuted. Let me unmute you one more time if you'd like to make a comment.
Can you hear me?
Yes, we can hear you now.
I am so sorry. I just can't figure out how to get my name in there. So do I have to do something different?
I'm not sure if on the attendee side you can do this, but you can right click your name and it might give you an option to edit it. If not, just log out of the WebEx and log back in, and then it should allow you to put your name in.
Thank you.
You're welcome.
And if you're here for continuing for CPD credit, you don't need to announce that you're here. We'll have you you logged on. And I'm going to ask Miss Whitney if she can just run over the guidance on CPD one more time, just to make sure we all got it. Can we do that during public comment, Anthony? I'm sorry, Mr. Payne. Can we just break really quick and do that again?
Madam Chair, did you say, do we need to go for public comment?
We're in public comment, but I think we just need to give the instructions for CPD again.
Oh,
Because
that's no
sometimes
problem. You
with,
can do that.
okay,
Yeah.
okay. It's just sometimes with the technology, it's hard to hear and react. So if we can just do
Good.
that really quick, I think it'd be helpful.
Sure.
Go ahead, Ms.
So
Whitney,
if
sorry.
okay, if you see your name in the WebEx, like a first name, last name, you don't need to do anything else. If you called in and you see a phone number registered, you would need to email Bob. And that email address is BOP for Board of Psychology, and then CE for Continuing Education at DCA for Department of Consumer Affairs .ca for California .gov for government. So again, BOP CE at DCA .gov.
Okay, thank you. Okay, now
Welcome.
we'll continue with public comment.
All right, this is the moderator. We're going to continue with public comment for items not on the agenda. Next, I have June Hayes. In June, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
I was excited when I saw I was able to attend some of these meetings, and have attended a couple in the past. But then I was frustrated because some of them are only in person, and so I can't check out what y'all are doing. And how come they're not hybrid? And whether you give us credit for it or not, it sure would be nice to be able to sit in on meetings. Sacramento is 500 miles away from where I am. So just a suggestion for the committee to consider to, with the wonderful technology we have now since COVID, it would be nice to be able to attend all meetings if I wanted to. Thank you. That's all I have. Bye-bye.
All right, this is a moderator. Our next individual who's requested public comment, Gwendolyn Evans. And Gwendolyn, you'll be given 2 minutes to speak with a 30-second warning. Please click the unmute me button when the prompt appears on your device. And Ms. Evans, you'll want to click the unmute me button if you'd like to make a comment for items not on the agenda.
Am I unmuted now?
Yes, you are unmuted.
Okay. I had a similar comment as that lady because I'm disabled and I'm not able to drive or get rides to Sacramento. And there were meetings that I'd like to have attended. So I had the same sort of suggestion if there would be ways to attend them virtually and get credit for that in the future. That was
All right, this is the moderator. We'll move on to our next individual who's requested public comment, Carolyn Lyons. And Carolyn, you'll be given 2 minutes to speak with a 30-second warning. Please click the unmute me button when the prompt appears on your device.
I'm sorry to return to the issue of the CPDs. I don't see my name or the name of other attendees anywhere. And from what I understood, that's how I know that my attendance is logged.
This is the moderator. Carolyn, it looks like I do have your name on WebEx. Because you are in the attendee view, you're not able to see other people in the attendee list.
I see.
Yeah,
Okay, thank you for the clarification.
you're welcome. And this is the moderator. It looks like we may have lost Dr. Kasuga, so I'm not sure if we have a quorum right now.
Oh, yeah, you're right. We don't have a quorum.
Madam Chair, what I might
She's-
recommend if
This
is
is
maybe just give her a minute to rejoin, and if not, we can always take a short break.
Okay, I see her on now.
Oh, okay.
We're still in public comment.
all right. Next, we have call-in user. Oh, I
I'm
apologize.
sorry,
Go ahead.
can you make sure that we have that Dr. Kasuga is on? I see her on the list, but
Sure. Dr. Kasuga, could I get a quick mic and video check from you? Oh,
Hello.
it looks like your virtual background may be covering you up.
Sorry. Sorry, I thought I was able to use my laptop. I'll go back to the phone.
Okay.
Because I guess I apologize, I have a new DCA laptop and it's been challenging.
Actually, Dr. Kasuga, before you switch, could you check that the little flip on your webcam isn't closed on your laptop? That might be why you're not appearing and it's just showing the virtual background.
What can you say that again?
Yeah, right above your camera on your laptop, there should be like a little switch, and it hides or reveals the camera.
Oh, got it. There you go.
Maybe try that and see if there you are. Perfect.
But it's a little bit like blurry.
all right.
There you go.
We
Thank you.
see you.
You're welcome.
It's a
And
new laptop.
and I think our committee member, Dr. Phillips, is on. Can you bring him up, Madam Moderator?
Let me refresh my list and see if I can find him. There we go. All right. And Dr. Phillips, can I get a quick mic and video check from you?
I am.
Perfect. And then can I also have you turn on your camera?
That's what I'm trying to do right now.
Perfect. Thank you. All right. Going back to public comment for items not on the agenda. I have a call-in user 14. You'll be given 2 minutes to speak with a 30-second warning. Because you're call-in, please click *6 to unmute yourself when you're prompted.
Hi, this is Dr. Karen Cady. It's wonderful to be here. This is my first telephone meeting to attend, and I want to reiterate what the other ladies said about offering the other meetings virtual. That would be great. I'd love to get more involved. Thank you.
That conclude our public comment.
This is the moderator. Let me check the Q&A box to see if there's any requests there. All right, and it looks like all the requests in the Q&A have been responded to, so it looks like there's no further requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you. Thank you, everyone, for joining us and for your comments on the availability of our meetings. We follow state law on how we organize our meetings, and it has been evolving in recent years. But know that we hear your feedback and we appreciate that you're joining us today. Thank you. So moving on to, and thank you for joining us, Dr. Phillips. Do we need to take roll again? Or are we good, Mr. Payne?
We are good.
All right. Here we go. Item number 4. Discussion and possible approval of the committee meeting minutes from the April 12, 2024 meeting. Ms. Whitney, do you, this is item, this item is on page 9 of the combined packet. Do we have any comments from the committee on the draft minutes?
I can move to approve the April 12, 2024 minutes.
Second.
Thank you. It's been moved and it's been moved by Dr. Kasuga and second by Dr. Phillips to approve the draft minutes from the April 12th committee meeting. Can we have a call for the vote here?
Can we just check to maybe have public comment before we have the vote, Madam Chair?
Oh, that's right. Sorry. I wrote these steps down for myself and I still missed it. Let's open public comment on the committee meeting minutes from April 12th, 2024.
This is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. All right, and it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Okay, let's call the vote.
Suga,
Aye.
Cervantes,
Aye.
Phillips,
Aye.
Okay, the motion carries. Thank you. Item number 5 is legislation from the 2024 legislative session, review and possible action. So on this one, it has several parts. So we're going to discuss item A. This one is an information item. And then we'll move to item B. And if the committee moves to take action, then we'll open public comment on those items. Is that a sound approach, Mr. Payne?
Yes, that sounds great.
Okay. Thank you. So item A is SB 1526, Consumer Affairs Psychological Associates, Business and Professions Code Sections 2913, Change of Supervisor Fee, Business and Professions Code 2987, Health and Safety Code 124-260. This item begins on page 23 of the combined packet, and it is information only. Mr. Polk, can you give us an update?
Yes, thank you, Dr. Cervantes. Yes, Senate Bill 1526 is related to the proposal that was submitted to the Senate Committee on Business, Professions, and Economic Development. The proposal was for technical, non-substantive changes to be included in the committee's omnibus bill. The proposal included amendments to the Business Professions Code 2913, 2987, and at that time, Health and Safety Code 124260. The full proposal and the amended language for Business Professions Code 2913 is included in the meeting materials. Currently, Senate Bill 1526 language includes the proposed amendments to only the Health and Safety Code, specifically codes 1374.72, 124260, and 128454, as related to updating the registration categories to the correct title, specifically removing registered psychologist and updating the title of psychological assistant to psychological associate. At the last board meeting, members approved the recommendation of the committee to continue to work with the Senate committee to consider the additional changes to codes 2913 and 2987 in hopes that the proposed changes will be amended into the bill. Board staff has reached out to the committee consultants regarding the additional amendments. Just at this time, we haven't received a response or an update on the additional amendment changes to 2913 and 2987. However, we're still continuing to reach out to the committee consultants, and hopefully we'll have a response soon and an update on those other amendments. So at this time, we're currently just reviewing SB 1526. We've submitted support position letters to the committees and attended the hearings. In the case that the amendments are not included into this bill for this legislative session, the board can always look towards next legislative session to submit a proposal to hope to be included in the omnibus bill for next year for business codes 2913 and 2987, or also we can look towards the board's sunset review next year as well. And that includes my report for SB 1526. I'm open for any questions.
Thank you, Mr. Polk. Is there any questions from the committee? Seeing none, we'll move. No? Okay. Dr. Phillips, you're good?
Yes, I'm good. Thanks.
Okay. Seeing no questions or further discussion, thank you for that thorough update, Mr. Polk. I think this is something well, hopefully we can get a resolution this year, but if not, we'll keep working on it. Item 5B, review of bills for review and consideration for action, position recommendation to the board. The first item, B1, is AB 236 by Holden, Healthcare Coverage Provider Directories. This item begins on page 108 of the combined packet. Mr. Polk?
Yes, thank you. Assembly Bill 236, which was introduced by Assembly Member Holden. Assembly Bill 236 would require a health plan or insurer to annually verify and delete inaccurate listings from the provider directories, and would require a provider directory to be 60% accurate by July 1st of 2025, with increasing required percentage accuracy benchmarks to be met each year until the directories are 95% accurate on or before July 1st of 2028. Assembly Bill 236 authorized the Department of Managed Healthcare and the California Department of Insurance either on or before January 1st of 2025 to develop uniform formats for health plans and insurers to use when requesting directory information from providers. Also authorized the Department of Managed Healthcare and the Department of Insurance on or before January 1st of 2026 to establish a methodology and processes to ensure accuracy of provider directories. On January 30th, Assembly Bill 236 passed the Assembly and was ordered to the Senate on May 1st. Assembly Bill 236 has been referred to the Committees on Health. Included in the meeting materials is the current amended bill text or bill language and the latest legislative analysis completed by the Assembly when it went to the Assembly floor. With the current bill language and how it applies to health plans and insurers, the current staff recommendation is to watch Assembly Bill 236 as the bill continues in the legislative process.
Thank you, Mr. Polk. Thank you, Mr. Polk. Is there any committee comment on this bill? No. Go ahead, Dr. Phillips.
I know this is of concern to our licensees, and there are frequent complaints on listservs and other locale about the accuracy of listings, that people's names are kept on the listings long after they've drawn from participation in insurance panels, and that this gives a misimpression to consumers. But this does as it is related specifically to health insurance, I believe it falls outside the bailiwick of the Board of Psychology. So I think the watch recommendation is an appropriate one.
Thank you, Dr. Phillips. Dr. Kasuga, do you have any thoughts on this?
I am in agreement of on the staff recommendation to have a watch position for this bill.
Very well. Then we won't take action on that item and we'll move it to our watch list. The next item is 5B number 294, Wiener Healthcare Coverage Independent Medical Review. This item begins on page 152 of the combined packet. Mr. Polk?
Yes, thank you. Senate Bill 294 was introduced by Senator Wiener. Senator Bill 294 was introduced as being effective July 1st of 2025. This bill would establish an automatic grievance process and automatic independent medical review process when a health plan or insurer that provides coverage for medically necessary mental health or substance use disorders modifies, delays, or denies an authorization request for coverage of treatment for a mental health or substance use disorder or an enrollee or insured who is younger than 26 years of age. Included in the meeting materials is the bill text, which includes amendments from January 11th. However, Senate Bill 294 was amended on May 24th, which now would make the requirements effective January 1st of 2026. And the bill would authorize the Director of Managed Healthcare and the Insurance Commissioner to promulgate regulations subject to the Administrative Procedure Act to implement and enforce the bill and to issue interim guidance. On January 29th, Senate Bill 294 passed the Senate and it was ordered to the Assembly. And on June 5th, Senate Bill 294 passed the Committee on Health and was then referred to the Appropriations Committee. The current staff recommendation is to watch Senate Bill 294 as the bill continues in the legislative process. The recommendation comes based on the affected health and safety codes and insurance codes related to the healthcare coverage.
Thank you, Mr. Polk. Do we have any comments from the committee? Go ahead, Dr. Phillips.
Similar, similar situation in the sense that it revolves around health insurance and so falls outside of our bailiwick. But again, as with the past bill, I'm sympathetic to the substance of the bill and the importance of healthcare coverage for substance abuse and mental health disorders. But I would say we should continue to watch the bill.
Thank you, Dr. Phillips. Dr. Kasuga, would you like to?
Yeah, so this
Go ahead.
bill, as well as the next bill that we're going to be discussing, is like interesting to me in terms of like whether it falls under our the idea of kind of like access to mental health services as part of consumer protection. And so like I always try to consider ways where we can increase parity of mental health and being able to have equitable access to mental health services as falling into our purview of consumer protection when we're trying to make sure that no one is like unable to receive mental health services, because then they're basically still harmed, but it's just like by not having access. So it's always like something that I try to acknowledge and try to thread the line where our where our consumer protection role kind of like ends, especially for those that are being harmed because they aren't getting access to services. So I think that, it's good. It's always good to kind of like support legislation where we can, increase access to Californians for mental health services.
Is Dr. Kasuga? So Dr. Kasuga, are you feeling like we should take the recommendation to adopt a watch position on this and keep an eye on it?
Yeah, I think that we should keep an eye on it as it unfolds, and Mr. Polk, this is still on the early stages as well, right? Or
I mean, it could be. I mean, yeah, because it was ordered it did pass the Senate and it was ordered to the Assembly, and it did pass the Committee on Health, and has been referred to the Appropriations Committee, which more look at the fiscal impact of the bill. However, that doesn't mean that amendments still cannot be applied to the bill. So there might be additional amendments coming through as the bill gets reviewed in the committees. So there's always room for amendments on the bill. So I don't want to say it's in the early stages, but I also don't want to say that it's not too late for additional changes. So
I think we try to approach these things very thoughtfully, and I'm of agreement. It feels just outside of the scope of the type of legislation where we take a position on. But I think it's appropriate to take a watch position and continue to monitor its development and how it may affect the licensees we're responsible to. So thank you. I'm not hearing that we should take a position on this, so we'll move to item number 3. Yeah. Okay, so item number 5B3, SB 999, Wiener Health Coverage, Mental Health and Substance Abuse Disorder. This item begins on page 171. Mr. Pope?
yes, thank you. Senate Bill 999 was introduced by Senator Cortesian. I know the memo says Senator Wiener, however, Senator Wiener is a co-author, so I just want to make that correction.
Thank you.
Senate Bill 999 would require health plans and insurers that provide coverage for medically necessary treatment of mental health and substance use disorders to ensure that utilization review determinations and appeals are determined by a healthcare provider that has appropriate training and relevant experience in the clinical specialty and diagnosis. The bill also requires contacts such as telephone and other direct access be available during California business hours for a provider to request authorization and conduct peer discussions and disclose the name and credentials of the reviewer. This also includes the basis for denial, including a citation to the clinical guidelines reviewed and analysis of why the patient did not meet the criteria if that is found. On May 21st, Senate Bill 999 passed the Senate and was ordered to the Assembly, which was then referred to the Committee on Health on May 28th. Senate Bill 999 passed the Health Committee and it was then referred to the Appropriations Committee on June 12th. After reviewing the bill text and the Senate analysis, which is included in the meeting materials, the staff recommendation is to watch Senate Bill 999 as it continues in the legislative process as well.
Thank you. Thank you, Mr. Pope. Is there any comments from the committee?
Mr. Polk, similar reasoning here, I assume, in terms of the scope of our authority as a Board of Psychology. Is that correct?
That is correct. Yeah. So after review of the analysis in the bill text and even the previous analysis, yeah, since it fell with more than the health codes and the insurance codes and stuff, the recommendation is based on those and considered to continue to watch.
I would be supportive of a watch position.
Thank you. Dr. Kasuga? Do you have
Be
any?
supportive of, sorry. Yeah, I am in support of
Go
a
ahead.
watch position as well. And I also wanted to just like echo that what I said earlier about being sympathetic to you know, the bill, and I'm all for increasing access to mental health services and other you know, psychological services, including ABA. And you know, it's not right that some of the services are getting denied because the reviewer isn't you know, the same field as the you know, the services that they're trying to evaluate. But I think it's also, you know, I agree with the staff that it is a little bit going beyond our scope as a board.
Thank you both for your comments. So we'll adopt the staff recommendation to keep to put adopt the committee recommendation for a watch on this bill. The next one is item number 4, SB 1120 Becker Healthcare Coverage Utilization Review. This item begins on page 152 of the combined packet. Mr. Pope?
Yes, thank you. Senate Bill 1120 was introduced by Senator Becker. And Senate Bill 1120 would require algorithms, artificial intelligence, and other software tools used on or on behalf of a healthcare service plan or health insurer for the purpose of utilization review or utilization management functions for healthcare services to comply with specific requirements, including they be fairly and equitably applied and would require a denial, delay, or modification of healthcare service based on medical necessity be made by a licensed physician or other healthcare provider competent to evaluate the specific clinical issue involved in the healthcare services requested by the provider and with the same or similar specialty as the requesting provider. As provided in existing law, the requesting provider recommendations are based on the enrollee's medical history and individual clinical circumstances. Senate Bill 1120 did pass the Senate on May 23rd, and it was ordered to the Assembly, and it was then referred to the Committee on Health and the Committee on Privacy and Consumer Protection. The bill is still in those committees, and I believe the agendas and the hearings are being scheduled. And along with the other bills that we've previously talked about, after reviewing and considering the information, which is also provided in the meeting materials for this item, the staff recommendation is to watch Senate Bill 1120 as well.
Thank you, Mr. Pope. Is there any staff, any committee or staff comments on this bill that Mr. Polk just updated us on?
No comment other than what we've already discussed related to the last few items.
Thank you.
The only comment I
you.
want to make is that I think it's good to watch bills that are related to any use of, you know, AI. So it's good to watch this bill.
Yeah, I concur. Thank you. So we'll adopt a watch position on item number 4 and move to item 5B5, SB 1451, Ashby Professions and Locations. And this item begins on page 215 of the combined packet. Mr. Polk?
Yes, thank you. Senate Bill 1451 was introduced by Senator Ashby. Senate Bill 1451, this bill would make various changes to the operations of programs governed by different practice acts and the business profession codes and various professions regulated by different programs. is all kind of stemming from sunset review oversight efforts. However, Section 2 of the bill would make changes which would clarify that no person shall use the words doctor or physicians, the letters or prefix doctor or DR, the initials MD or DO, or any other items or letters indicating or implying that a person is a physician and surgeon, physician, surgeon, or practitioner in a healthcare setting that would lead a patient to determine that the person is a licensed MD or DO. On May 13th, Senate Bill 1451 passed the Senate and was ordered to the Assembly, which was then referred to the Committee on Business and Professions. In reviewing the bill analysis and bill text, which is included in the meeting materials, the staff recommendation is a support if amended position. The support if amended position would be in hopes that the bill would include clarifying language that the board's licensees can still use the title of doctor or the initials DR as long as the licensee is not being misleading or misleading clients. And perhaps might tag in Mr. Payne to provide maybe further details on the policy of the bill. But I would like to add that the Board of Chiropractic and the Board of Registered Nursing has taken an official position on this bill. Their positions are opposed unless amended, and they are proposing amendments that would, in line with what our proposed amendments would be, to clarify the language which would exempt their licensees. The California Psychological Association has also submitted a letter which outlines their position, which is also an opposed if amended position on SB 1451, and their position and concerns is provided in the letter, which is included in the meeting materials. So yeah, the recommendation is a support if amended, and just like I said, just hope clarifying language somewhere in the bill that it would, our licensees could still use the title of doctor or DR as long as they're not being misleading. Thank you.
Thank you. Mr. Payne? You helped me understand this this bill the other day.
Yeah, happy to. So this bill currently provides additional context to the prohibition that's currently in the law. And as you all may know, this is under the medical board's jurisdiction. So what the additions in the bill do is kind of provide additional context and a frame for how the medical board might choose to enforce the statute. So the parts that Troy was discussing that specifically refer to leading to a reasonable person to conclude that the person that's using the term doctor it wouldn't lend a reasonable person to believe they're a surgeon, then that's fine. So the point is to try to help contextualize this existing enforcement right that the medical board has. And so the question is, from a policy perspective for this board, certainly is, does the committee, and by extension the board, do they like these changes? Is this helpful to their licensees? If yes, if no, and those are all helpful policy discussions. But that's essentially what the changes mean in terms of what as compared to how the current law reads. Currently, there isn't any sort of contextualization of the prohibition on the use of those terms. This bill provides additional attempted clarification. As a policy matter, the board may decide that it doesn't clarify it, but that's the attempt with this bill, if that helps.
Thank you, Mr. Payne. Is there any committee comment or questions? Go ahead, Dr. Phillips.
Obviously, it is of concern to our licensees that they'd be able to express the fact that they have a doctorate in the context of providing services. To my knowledge, none of us are pretending to be medical doctors, but I think it's important that we do get clarification of the bill so that none of our licensees would run afoul of the statute as written. So I would support the staff recommendation that we take a supportive amended position or an oppose if amended position, depending on what strategically is the best, but an amendment is needed.
Is that a motion,
You know,
Dr. Phillips?
Yes.
I'm inclined to align with the oppose unless amended position of other boards that regulate at the doctoral level.
I would concur. I make a motion that that the board recommend, or the committee recommend to the board taking an oppose if amended position to further contextualize the use of the word doctor or the prefix DR period.
I
Thank you.
second the motion.
Thank you, Dr. Phillips and Dr. Kasuga. We're going to open public comment on items. Oh,
sorry, Dr. Cervantes. I just wanted to ask board staff as well to talk about possible impact this will have on board staff if it passes as is, in terms of kind of like complaints or confusion with regards the bill for our board staff.
Yeah, sorry, I was having audio issues. Yeah, so if as far as board staff goes, there is a possibility of more complaints coming in regards to the use of the doctor or DR, if licensees are using those and consumers are reviewing it. So it is a possibility that enforcement might receive more complaints in this aspect. But as the bill continues, we'll keep monitoring, and if required, we can always do a fiscal impact on it as well.
thank you. Anything else before we open public comment?
This is Antoinette. Just a brief add-on to that. I think it's more of we've heard from licensees that just don't want to run afoul of the law of the Medical Practice Act. So some clarification and adding context to when it would be appropriate to use your title for which you have a degree for, I think would be helpful. And just to make sure that the language is such that is clear.
Thank you.
Thank you so much.
Seeing no other staff or committee comment, we'll open up public comment for 5B5 SB 1451 Ashby Professions and Vocations.
All right, this is the moderator, and at the direction of the committee, I have opened up public comment. Members of the public, if you'd like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. And it looks like we do have a couple people requesting public comment, so I'm going to go in the order received. First, I have Andrea Davis. And Andrea, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Thank the committee so much for considering the bills that I had requested that we look at related to number 1, 2, 3, and 4, related to patient access to care and equity of access to care, as well as protecting our licensees and being able to provide services that are properly reviewed. In terms of 1451, number 5, I'm calling in today as part of the California Psychological Association Local Advocacy Network Committee, and I'm the representative from that committee to our largest division, Division 1. And I'm requesting oppose unless amended position on 1451 based on the letter that we cooperated together to provide from the California Psychological Association and all the research and reasons why we're suggesting that the board take a position on this because of the concerns about the California might become the only place in the country or the world where psychologists are questioned in terms of their use of the word or title doctor, and that could be very confusing to the public. And I love the idea, Mr. Polk, of providing a fiscal impact estimate of the new complaints that might come in.
30 seconds.
Okay. So I thank you for considering to join the California Psychological Association in an opposed position unless amended. Thank you.
All right, this is the moderator. Our next individual is Dr. Elizabeth Winkleman. And Dr. Winkleman, you'll be given 2 minutes to speak with a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Winkleman from the California Psychological Association. I'm the Director of Professional Affairs. I want to thank the committee for considering and oppose unless amended position, which is the position that, as has been mentioned, CPA has taken. We're also working in a coalition with other associations, professional associations, who are also have opposed unless amended position. I wanted to specifically mention there already are some restrictions on how psychologists can use the word doctor or prefix DR in this current law, and this is an opportunity to fix that problem. I haven't heard of any psychologists actually getting in trouble for using the term doctor or DR, but I think it's especially important not only so that there isn't an expansion of the prohibition, but to fix the current language. And it is a misdemeanor right now, so it's not something that's specifically in it's in the licensing law for the physicians, but it's actually a misdemeanor, and it would expand the scope of when using the terms would be a misdemeanor. So thank you so much for considering the oppose unless amended position. I think it's a very important bill for us. Thanks.
All right, this is the moderator. Next we have June Hayes. And June, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Yes, this is Dr. June Hayes, PhD, licensed psychologist, and I would support the discussion on oppose unless amended. I don't think the public is as stupid as and uninformed as this bill may suggest, that people don't understand the difference between doctors and physicians. There are times when that needs to be clarified with members of the public who are unaware of the difference. And I think it behooves all of us to make that clarification when we know or suspect that somebody is misusing it. But changing so people cannot be called doctor who have attained a doctorate degree not only affects psychologists, but it affects the entire academic profession of people who are teaching in the professions or in the universities and have achieved a doctorate. And this bill is just too far reaching and just implies too many changes to things that affect too many people. I think it's a power grab. And again, I support oppose unless amended. Thank you.
All right, this is the moderator. Next we have Aravinathan. And you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Can you hear me?
Yes, we can hear you.
Yeah. So yes, I had the same concern as well. I'm a psychologist, and one reason I wanted to be a psychologist is also, to have the title doctorate. So we spend years on education, wanting to get that sort of, doctorate degree, and then not to be recognized and validated. Sounds really like, that, as the other people were saying, that it seems to be like it's more of, certain professions wanting certain, control. So I was just I wasn't very clear. Are they saying right now that we can't call ourselves doctors in all settings, or is it just medical setting, like in a hospital? So that was a question I had, because I can understand, like, if you're in a hospital, it can be very confusing when you say, medical doctor as opposed to a psychologist. But in general, not be able to call yourself doctorate seems, it's kind of disturbing to me and concerning. So just wanted to bring that up.
All right, next we have call-in user 16, and call-in user 16, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device. I believe it's going to prompt you to press *6.
Hi, can everybody hear me?
Yes, we can hear you.
Okay, perfect. I agree with my previous psychologist, especially with Dr. June, in regards to the right for us to say that we are doctors, because we have earned that right with the schooling and everything like that. I'm just a little confused on the bill and what it would do if it were to be, passed, and if there can be language that can be revised, as a previous psychologist had mentioned, in regards to us being able to call ourselves doctors. And then I had another just comment in regards to the watch bill for the providers being on the healthcare coverage. I have hundreds of clients that call me daily because my name is listed, but I'm not providing certain therapeutic services, and they're getting frustrated and discouraged because they keep calling number after number and the lists are not accurate. And so by the time they come to me, they're desperate and just, asking how I can assist, which could be avoided so I can focus on my population that I'm actually serving. It's just a lot of unnecessary calls that my assistants are weeding out if the provider
30
lists were
seconds.
updated in the websites as well. And that's it.
All right, this is the moderator. Next we have Tyler Reend. And Tyler, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
About that. It took me a second. Good morning, Tyler Rindy. I'm the Director of Government Affairs with the California Psychological Association. Just want to say thank you to you all for considering an opposed unless amended position on the legislation. The one thing that I would just add is that this was language that was added just a few days before the Senate Business and Professions Committee. No stakeholders were alerted to that this language was added a couple days before the hearing in April. And one of the things that was listed in the analysis in the Senate is that, and I'm just going to read the sentence, optometrists, dentists, chiropractors, psychologists, and other practitioners possessing professional doctorates are also expressly authorized by the law to use the term doctor. And so it was made as a commitment at that time to end up clarifying around the use of psychologists in the term, or psychologists in the use of the term doctor. However, in the last 2 months, we have not seen any language put forward. So just appreciate that the board is considering an opposed unless amended, because we think it's important to show show the importance of how important that language is for our licensees and for those that are practicing psychology, and the just recognizing the level of education and experience that psychologists have. So thank you again.
All right, next I have call-in user 14, and call-in user 14, you'll be given 2 minutes to speak and a 30-second warning. Please click *6 when the prompt comes up for you to unmute yourself.
Hello, this is Dr. Karen Katie here, and I just wanted to make a comment and ask a question. The comment is, when I was in training, I worked in a medical establishment in downtown LA, and it was actually very important in that context for the psychologists that were there, because we were right inside the practice with other various licensed personnel that were also doctors, for us to be known as doctors. And we actually utilized the doctor-patient model in that setting. And so where in my other settings, I refer to my clients as clients, they wanted me to refer to them as my patients there. And, you know, that's probably the one environment where you would have the finest line with the patient/clients as to, you know, who is this? But there was never an issue. I think that it's very important for the board to stand up for the intrinsic value of this legacy that, you know, we have been attached with, and to not see that eroded in any way, shape, or form. And my question is, I'm kind of unclear
30
as to
seconds.
where this thrust is coming from. That may be something that would, you know, be of interest to many of us. I'd like to know who's bringing this up, since, you know, a couple of weeks ago I noted that Marjorie Taylor Greene, you know, tried to devalue Dr. Fauci on the Senate floor. So anyway, just wondering where this is coming from, and a little suspicious, and we really need to act strongly to protect this right and legacy. Thank you.
All right, this is the moderator. Next, I have Charles Broderick. And Charles, you'll be given 2 minutes to speak with a 30-second warning. Please click the unmute me button when the prompt appears on your device.
My name is Charles Broderick. I too join the others with the regarding professions and vocations about the use of the term doctor. I agree with the others. We should oppose this unless amended. I'm here as a private individual here today, but I work in the state psychiatric hospitals. There are several hundred of us psychologists working alongside other medical professionals in the state psychiatric hospitals, and the status quo seems to be working fine. We've never had any issues in our day-to-day use of the term doctor when we're acting as psychologists, when we're treating our patients, and we're working alongside, you know, physicians, psychiatrists, neurologists, nurses, psych techs, social workers. I've never been aware of any complaints in my ordinary day-to-day usage. And in fact, I think using the term doctor for psychologists also helps differentiate us from other professions as well, and helps, it probably may actually eliminate some confusion in the minds of patients, since they're able to, they can categorize who is a doctor and who isn't, and what each person role is in their treatment. So I'll just, I can end it there, but I do want to support oppose and unless amended for that ASH bill. Thank you very much.
All right, this is the moderator. Next, I have Catherine Marario. And Catherine, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
My name is Catherine Marrero. I am a neuropsychologist working in a medical center. I'm the director of neuropsychology at the Ray Dolby Brain Health Center. And on this issue, I just want to echo the sentiments of my colleagues and also add that I think there's a potential equity issue here. We know, at least in terms of gender, we know that women are a majority of psychologists, whereas there's a gender gap in terms of medical physicians that favors the opposite direction. And I can tell you from my personal experience in the hospital setting in which I am in, all of the neurologists I work with are men, and all of the neuropsychologists I work with are women. And I think it adds to, there is a bias implicit in a bill that would go in this direction. Thank you.
All right, this is the moderator for the people who use the question and answer feature. First, I have Blanca Magia. And Blanca, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device. All right, you are unmuted.
Okay, thank you. I just wanted to clarify. So what would you recommend as of now? Because it sounds like it's, as of now, would you recommend that we still use the title doctor or to avoid it until we get, until something happens with this bill?
The bill is under consideration, so we wouldn't have a recommendation until we had direction of if the bill passed or not. What we're trying to determine right now is a position that we're going to recommend to the board, the full board, on this bill.
All right, this is the moderator. Our next person who's requested public comment, Anita Peterson. All right, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
In California, and I just wanted to agree with the oppose unless amended position. That's all.
All right, and this is the moderator. Our next individual, Dr. Trista Carr. There you are. You'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Everyone. Yeah, so I just want to concur with all of our colleagues or all of my colleagues here that have been voicing their opinions. Honestly, the bill is kind of offensive. We have spent a ton of time and money obtaining doctorates. Why would we not be called doctor? So please oppose any bill that diminishes the work that we've done. Thank you.
All right, this is the moderator. It appears that was our last request for public comment. Would you like me to? Oh, I apologize. It looks like we have another request. Harvey Billick, and Harvey, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
I just wanted to get a clarification and then share some information. The clarification is I thought that we were considered medical people currently, and the information is I do contract work with Social Security Administration, and they consider psychologists acceptable medical sources. That's the word they use, acceptable medical source. There's no distinction. They can evaluate all mental impairments. So I don't know if that's helpful or not, but that's my understanding right now.
All right, this is the moderator. Our next individual is Jennifer Franklin. And Jennifer, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
My name's Dr. Jennifer Franklin.
I'm licensed in California and also in North Carolina. And like my colleagues have shared already, I have concerns about this bill. I feel that it doesn't make sense that, again, like somebody said just a moment ago, that we should pursue a doctorate degree with all the time, money, energy we put into it, hard work, and then to be told we cannot call ourselves a doctor. It does not make sense to me. I think if there is any question about the public's perception and trying to make sure the public perceives us accurately, I think that is more of a PR problem that maybe we need to address better as psychologists, as a community, to help educate people about what kind of education psychologists get and how that compares to other mental health professionals, how that compares to MDs, but that does not diminish the qualifications we have for calling ourselves doctors. I had one other comment, trying to remember it. Gosh, I cannot remember what it was, but I would agree that this bill should be opposed unless amended. And I am offended that it's been presented in the
30
first place.
seconds.
Thank you.
All right, this is the moderator, our next individual who has requested public comment, Zanaya Mendoza. And Zanaya, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Anya Mendoza. I'm a clinical psychologist and consultant as well for various forensic settings and government positions. And similarly to my colleagues, I have concerns about this language and potential title change regarding our status. I do believe that it's prompted by a lot of confusion for consumers, given that a lot of mid-level practitioners pursue additional doctorates beyond what is expected of their licensure, and they do call themselves doctors, which I believe is not accurate, because although they did spend the time getting the additional education in terms of their clinical licensure scope of practice, they are operating under a master's level title. As I do believe that that's what is causing a lot of this decision to take a closer look at it. And like others have already echoed, this has been a longstanding tradition of in hospital settings and written into bylaws and privileges in hospitals. Psychologists are given similar privileges and rights as a physician. And it's only recently that this has kind of been under scrutiny, I would argue, because pretty much anything can get a doctorate now, including physical therapists, social workers, and I do believe that their education is important, but it's misleading to
30 seconds.
The consumers and the patients that they serve to represent themselves with a doctor title, because it is not necessary for the scope of practice that they provide. So I would ask that the board maybe take a special stance on highlighting that specific piece, because I think that really is the one thing that will set us apart and give more veritas to what we're saying. And also maybe even be better at, I don't want to say disciplining, but investigating people who are misrepresenting themselves with that title in the public. Thank you.
Thank you. Before we take another public comment, I want to just pause and hear from our general counsel, Mr. Payne.
Thank you, Chair. I did just want to try to clarify something on this issue, not from a policy perspective, just what's in the law currently. Currently, the medical board has a statute that has a prohibition of the use of the word doctor. The way that statute has been applied to date has been where someone has a degree of a doctor but has held him or herself out as a medical surgeon. That's how that statute thus far has been applied. I appreciate and understand the concerns that the members of the public are raising around this issue. And again, I don't raise the public policy perspective of it. I just want to try to be as clear as possible of what the current legal status is. The attempt, and this may not be a good attempt, but the attempt in this bill is to provide additional clarification to an existing medical board statute around that prohibition. Thank you.
Thank you. Thank you, Mr. Payne.
All right. This is the moderator. Oh, I apologize.
Well, do we still have several public comment?
It looks like we have one more.
Dr. Phillips, did you want to comment now, or did you want us to take this last comment? Dr. Phillips?
Excuse me, I didn't have I was chatting away there. I think what this bill may be reacting to is not so much psychologists or other qualified professionals who use the term doctor. I suspect it has to do with people that are holding themselves out to be a naturopathic doctor, or I think one of the most frequently used terminologies now are functional medicine doctor, which can create some confusion as to what the qualifications of the individual are. I'm not sure that they're trying to focus on us particularly, and I just think the language as written is overbroad in the sense that it could sweep psychologists or other professionals who rightly use the term doctor to into the whole issue. So I think with clarification, hopefully the concerns of our licensees and the concerns of the board will be addressed. So I just thought I would add that in to the extent that it clarifies the conversation.
I think both your comments and Mr. Payne's comments are helpful right now. Thank you. We'll take the last public comment, and then we'll come back to vote on the motion we have on the floor. Go ahead, Madam Moderator. Yes.
Next we have Parvin Salked, and Parvin, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
So glad I joined you. I'm so glad I joined you today to hear this news. I concur with my colleagues about the title. I am going to be licensed 30 years in August, and I have worked number of years in hospital settings and also many years in multi-specialty clinic. No one ever mistook me for a physician, MD, because I always introduce myself immediately saying, this is Dr. Salked, I'm a psychologist. So I clarify who I am instead of just saying I'm Dr. So-and-so. So if anyone is misusing the title, they should be disciplined individually, not as a whole. Thank you so much for your time.
Was that our last public comment?
I believe so. Would you like me to close the Q&A panel?
Yes, please. So the motion for the committee right now is to recommend a position of oppose unless amended for SB 1451. It was moved by Dr. Phillips and second by Dr. Kasuga. Can we call the vote?
Dr. Cervantes, I just wanted to have a comment as well before we
Okay,
hold the
would you
vote.
like to do that before the vote?
Yes.
Go ahead.
So I just wanted to kind of like I appreciate the clarification, and I understand that the intent is not targeted towards psychologists, but that the lack of clarification has uh, unintended consequences that affect our licensees. And on top of that, there are also a lot of unintended consequences, not just in terms of our ability to call ourselves doctor, but it has a lot of unintended consequences in terms of parity that we've always been kind of like wanting to protect in terms of our field, the field of psychology, in terms of parity and in terms of ability for pay, because like some of this eventually leads to kind of like disparities in terms of medical physicians versus psychologists. So I understand that the intent of the bill is to address other fields that have an unclear criteria as to how they became doctor that's related to medicine, like what the example that Dr. Phillips provided. But this doesn't only affect psychologists that work in hospital settings. It affects psychologists in various settings, including like there are a lot of settings where psychologists and physicians have been working hand in hand without confusion. And there is I need to just clarify this law so it doesn't affect psychologists, and they can continue to like be able to be recognized for their level of education, and be able to use doctor without feeling that they're gonna be facing misdemeanors by from a complaint about someone mistaking them for posing as a surgeon.
Thank you, Dr. Kasuga. So we have the motion that's been moved in second. Are we ready to call for the vote? Yeah.
Kasuga?
Aye.
Cervantes?
Aye.
Phillips?
Aye.
Thank you.
The motion carries. Thank you. So before moving to item 5B, we are going to take, I promised we would do a time check at 11 and I broke that commitment. We're gonna go ahead and take a 10-minute break, and then we'll resume and then do another time check because we do need to break for lunch at 12:30. So we only have a few items left on our agenda, but I want to make sure that we can consider them as thoughtfully as we have these ones we've been discussing. So let's go ahead and take a 10-minute break, and we'll resume at 11:45. Does that sound good?
Sounds good.
Or do we need more time from we're good with 10 minutes? Okay. Thank you, everyone. Welcome back, everyone. We're at 11:46. Miss Whitney, can you help us establish a quorum?
Kasuga?
Here.
Cervantes?
Here.
Phillips? We have a quorum.
Oh, thank you. And I see Dr. Phillips popping in. Let me give him a moment to get situated. All right. It's Mr. Payne, I have a quick question. We have we just finished item 5B on the agenda, and we took action on 5B5 and took public comment. We have items 5C and 5D left on this item. When would be appropriate to take public comment? Could we do that at the end of presenting C and D and then take public comment for the entirety of item 5? Are you with us, Mr. Payne? Mr. Payne, are you with us?
Yes, I'm here.
Did you hear my question, or
I
would
did
you like
not.
me to
I just joined.
Okay, no problem. I'll just repeat my question really quickly.
Yes.
We just finished item 5B, and we took action on one item in 5B5. So now we have item 5C next, and then we have item 5D. Both are informational. Could we proceed and take public comment for the entirety of item 5 on the agenda after we hear an update on or move through the agenda to item 5D?
Yes, you may do that.
Okay, I
You
just
may wait
wanted to
on
make
public comment until the conclusion of item 5, and before moving on to item 6, you could take public comment on the entirety of item 5.
Okay. Thank you for the clarification.
You're
I
welcome.
also want to make sure that staff and everyone involved knows what to expect as we're moving forward. Thank you. So thank you, everyone. We've established quorum. We have clarification on our process, and now we'll go ahead and move forward with item 5C. And this item is bills with active positions taken by the board. These items are presented in our board packet. Do the members of the committee have any items they would like to discuss in 5C? No? I just want to thank Mr. Polk for keeping us updated on these items in our packet. We'll move to item 5D. These are watch bills.
Dr. Cervantes?
Yes.
I'm sorry, I would just, if it's okay, I would just like to provide an update on item 5C1, Assembly Bill 1991, just with some recent information that board staff received.
Oh, you know what? And do we have an update on item number 7 as well?
Yeah, item number 7 as well as item number C6, SB 1012.
Okay. So I was moving fast on you, Mr. Pope.
No, it's
Sorry
okay.
about that.
Yeah,
So
no
let's go
worries.
ahead and get an update on item 5C1, item 5C6, and item 5C7. Go ahead, Mr. Pope. Start with number 1. That one is on page 245 of the combined packet.
Thank you. So starting with Assembly Bill 1991, this bill, the board currently has an opposed position on this bill, as there was concerns with the bill language making it a full requirement for licensees and registrants to complete the workforce data or the demographic survey at the time of online renewal. And if a licensee failed to fulfill that requirement, it was possible that that licensee or registrant may face enforcement action. I just want to advise the staff, the committee, that staff has been in contact with a consultant or consultants with the Assembly Health Committee and with the consultant from the Senate Business and Professions Committee. There are proposed amendments that are most likely going to be introduced into the bill that would actually remove the requirement Instead, it would just be that it has to be requested. So the demographic survey or the workforce data survey would just be a request. And then at that time, only portion of the personal data that would be required to be provided is the national provider identifier number. So it seems with the proposed amendments, if they're included into the bill language, it would address the board's concerns. So there may be a staff recommendation once it is amended to remove the opposed position and just continue to watch Assembly Bill 1991.
Thank you for that update. This is, I'm sure, will be something that we'll discuss at the board meeting if those amendments are made. Thank you. And then the next one is number 6.
Yeah, so I just want to advise, so SB 1012 was introduced by Senator Wiener. The board was opposed on this bill as well. And then this is the bill that would have enacted the Regulated Psychedelic Assisted Therapy Act and would have created the new board under the Department of Consumer Affairs, titled the Board of Regulated Psychedelic Facilitators. Like I said, the board was opposed on this. We did submit opposed letters to the author's office as well as to the committees. I just want to advise or make note that that bill was held in the Appropriations Committee and it failed to move out of that committee. So that bill is no longer going to be going through the legislative process.
Thank you. Thank you for your advocacy of our position on that. Item number 7, SB 1067.
Yeah, so item 5C7, Senate Bill 1067, which was introduced by Senator Smallwood Cuevas. The board did take a supportive amended position on this bill, and we did submit our position letter to the office as well as the committees that outlined our proposed amendments to clarify the definitions of medically undeserved area or population and kind of hopes clarify what documentation would be required to meet that criteria. That bill did go through amendments to where it clarified what boards would be subject to these provisions. And the Board of Psychology was not included in those amendments. So if the bill passes, the board will not be required to enforce those or enact those provisions of expedite applications.
Thank you. Do we have any questions or comments from the committee on the updates that Mr. Polk presented? Seeing none, we'll move to item. Okay, thank you. Seeing none, we'll move to item 5D. These are our watch bills, and the board has adopted watch position. So these are 2 bills that we are that our team is monitoring. Would the committee members like to discuss either of these bills? We have a report in our packet.
I'm good, thank you.
Okay, excellent. So hearing no further comments or questions on these 2 watch bills, I'm going to open up public comment for item 5 on the agenda. Item 5A, B, C, and D.
All right, this is the moderator, and at the direction of the committee, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And it looks like we have a couple requests. First, I have Kenneth Parker. And Kenneth, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
And Parker, with an unrelated question that I've been trying to get clarity on. I have a 12 o'clock appointment that conflicts with the finish of this meeting. Would I get credit for the time spent?
Ms. Whitney, can you pop in and answer the question?
You would get credit for the time that you attended the meeting. So if you attended from 10 to noon, you would receive 2 hours of CPD credit.
Thank you.
All right, this is the moderator. Our next individual has requested public comment, Stephanie Chen. And Stephanie, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Can everybody hear me?
Yes, we can hear you.
Okay, thank you so much. So on behalf of the California Institute of Integral Studies, we share the board's concern with AB 2051, and we also oppose this bill. Now, CIS is an internationally recognized university based in San Francisco, California, and we enroll more than 1,500 students pursuing graduate degrees, and houses a Department of Clinical Psychology doctoral program. We are regionally accredited by WOSC. And we just want to emphasize that we are in strong agreement with the board that AB 2051 would undermine California's values of diversity and inclusion by allowing out-of-state practitioners to practice in California without necessary cultural diversity and social justice training, and potentially allowing to conduct harmful practices such as conversion or reparative therapy for LGBTQ+ patients. AB 2051 would also harm regionally accredited institutions like CIS, which serve historically underserved groups and devote significant training providing services to these groups by excluding them from participating in SIPAC. So we thank you for standing up for equity,
30
fairness
seconds.
among licensees and the state's educational institutions. Thank you.
All right, this is the moderator. Our next individual is Andrea Davis. And Andrea, you'll be given 2 minutes to speak and a 30-second warning. Please click the unmute me button when the prompt appears on your device.
Good morning. Again, it's Dr. Andrea Davis, a licensed psychologist and owner and founder of Greenhouse Therapy Center in Pasadena. It's just switched over to afternoon, so good afternoon. And I wanted to circle back to some comments on the committee about legislation that impacts insurance, because it's a new day where many patients are relying on insurance coverage, especially for more intensive kinds of treatments, such as substance abuse or behavioral health treatment for autism. And so I want to circle back to SB 999 and point out that this board has supported other bills in the past related to insurance if they impacted licensees and consumers in California. And this bill in particular protects the role of psychologists and other mental health providers to be the people who would be in charge of denying or approving coverage for mental health and substance abuse treatment. I think that's extremely important that a registered nurse in another field is not asked by the insurance company to deny treatment for one of our patients. And it really would prevent this, our roles being overtaken by other healthcare providers in this issue of denial of coverage, approval of coverage, authorization of coverage. It is a very important bill for protecting the licensees and the consumers of California mental health services. So I do ask a reconsideration of that position in the future, that bills that pertain to insurance do impact the scope of the Board of Psychology, particularly SB 999. So thank you very much.
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you. Thank you. Thank you, committee members and members of the public and staff for your thoughtful comments on item 5 on our agenda. It's always very insightful for me to hear and consider all of the different viewpoints. Although we've been largely in agreement, it doesn't, we take the feedback seriously. I think so do the staff and the committee members. I won't speak for them on that, but I know they do because we have we talk about it here. Thank you, everyone. So moving on to item 6, legislative items for future meeting.
Cervantes?
Oh, yes.
Sorry, I have my hand raised. Sorry.
Okay,
I
sorry,
just wanted
Dr.
to
Kasuga.
I just wanted to ask staff, Mr. Polk, if do we have any updates on 5C2, or if there's none, then we can just move on. Just because there was a comment on it.
I'm sorry, can you repeat that?
I just wanted to ask Mr. Polk if there is an update on 5C2 AB 2051, because there was like a public comment, and if there's any updates, I just wanted it like shared.
Sure. There was an amendment to the bill on May 20th, and the amendment included the language that any person who's authorized by the compact to practice in California as an employee or contractor of another state is prohibited unless they are licensed by the board. So that was the most recent amendment as of May 20th. Between then and now, board staff has submitted the opposed position letters to the author's office, as well as the Assembly Business Professions Committee and the Committee on Appropriations. It did pass in both committees, so we did submit a floor alert in opposition to all Assembly members. The bill did pass in the Assembly and has been ordered to the Senate. It's been double referred to the committees on business professions and economic development and the Committee on Judiciary. We do have opposition letters drafted, which are currently being reviewed. Once the review is complete, the letters will be submitted once again to the author and to the committee members in both committees. The bill is scheduled for hearings in both committees, one on the 24th of this month, and the next one would be on July 2nd. So board staff will be attending those hearings and providing in-person testimony in opposition of AB 2051. And as the board actually has been in contact with the California Institute of Integral Studies, just to kind of go over our concerns in the letter that we submitted previously. And I believe that they have submitted their letter as well in opposition of AB 2051. So.
Thank you for that update. Thank you, Dr. Cervantes.
Thank you. Thank you both. Okay, moving on to item 6, legislative items for future meeting. The committee may discuss other items of legislation in sufficient detail to determine whether such items should be on a future committee or board meeting agenda, and/or whether to hold a special meeting of the committee or board to discuss such items pursuant to Government Section Code 11125.4. Is there any committee comment on legislative items for a future meeting?
I have no comment.
It's staff?
I don't have either.
Thank you. Staff? Seeing none, we can open public comment on this item.
This is the moderator, and at the direction of the committee, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. All right, and it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Yes, please. So item 7 is a regulatory update and review and consideration of additional changes. And I asked Mr. Polk to help us by providing us these updates.
Yeah, so I have an update on a couple of the regulatory packages listed. Starting off with item 7A, this is the inactive psychological associate registration and reactivating a psychological associate registration if it's put on inactive status. So this package was approved by agency and was sent to the Office of Administrative Law for approval and publishing, which was approved. And the 45-day public comment period started on April 5th and it was completed on May 21st. We did receive one comment, but it didn't warrant a hearing as the information provided in the comment was addressed in the package's informational statement of reasons document. So currently board staff is working with regulatory counsel to complete the final documentation. Once the documentation is been reviewed, we will submit that information for final submission and approval by Office of Administrative Law.
Thank you. And then do we have updates on F&G as well?
Yes, so item 7F, this is regarding the regulatory package for the EPPP Part 2. On May 10th, the board approved additional amendment to the regulatory language, and currently board staff is beginning to draft the initial regulatory documents and will be working with our regulatory counsel to get the initial package completed.
Thank you. And item D, we are moving.
Yes, on item 7G, this is regarding the regulatory package for the research cycle analyst registration that's moving from the Medical Board of California to our board. So the board approved the adoption of the amended language with the non-material changes added for necessity and clarity. Like I said, to move the current regulations from the medical board to our board. So currently board staff is working with our regulatory counsel as well and the fiscal office to get the initial package submitted for departmental review.
Thank you. When I first joined the board, the regulatory packages stayed on the same status for a longer period of time. So I appreciate how carefully, there's so many hours of labor that are behind the scenes here. And I appreciate your summary and updates at our meetings on these regulatory packages and everyone involved with these, including Mr. Singh, who I think is still with us. Thank you. Any committee comment on the updates? Seeing none and seeing none from the staff, we'll go ahead and move to item number 8 on the agenda. This is recommendations for agenda items for future board meetings. Note that the committee may not discuss or take action on any matter raised during the public comment section except to decide whether to place the item on a future agenda or future meeting. This is in Government Code sections 11125 and 11125.7. Is there any committee or staff comments on item number 8? Seeing none, let's go ahead and open public comment.
All right, this is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. All right, and seeing no requests for public comment, would you like me to close that Q&A panel?
Yes. This concludes our business for today. Thank you everyone for your work behind the scenes to prepare us to have a good meeting. Thank you all of our public commenters for sharing your insight with us. Before I close our meeting, I just want to check in with my committee members to see if there's any comments they'd like to make, and then we'll adjourn.
Oh, ma'am,
Dr.
that was a
Phillips?
very successful meeting.
Yeah,
Thank
just
you.
thank you for leading us through the meeting.
Thank you both. This adjourns our meeting. It's 12:13. Thank you.
Chair,
No lunch break. Sorry, folks.
Chair, could we
Oh,
do
oh.
the final CPD comment, please?
Oh, yes. Hold on, everyone. Don't hang up yet.
Thank you.
Whitney.
You're welcome. Have a good weekend. Thanks. Thank you. Ms. Moderator, do you have the slide that you could put up for attendees?
Yes, one moment.
Thank you.
Don't leave us, public. Hold on. Hold on. This is very important for everyone who joined us for CPD.
Apologies, WebEx is a little slow. And there it is.
So thank you for attending today's Legislative and Regulatory Affairs Committee meeting. For today's meeting, you will receive 2.5 hours for your participation under CPD category number 1, attendance at a Board of Psychology meeting. These hours can also count towards the law and ethics requirement. For your records, please note today's date as June 14th, 2024, and the name of today's meeting, which is the Legislative and Regulatory Affairs Committee meeting, and 2.5 hours for your records. Again, if you called in, please email bopce@dca.ca.gov with your name, license number, and phone number that you used to call in. If you signed in using a computer or mobile device and your name was in the name slot, there's nothing else you need to do for that. Thank you, and back to you, Madam Moderator.
Thank you. Thank you, Ms. Whitney. Okay, this adjourns our meeting for reals now. It's 12:15. So you're free for lunch on your own. Thank you, everyone. Take good care.
Thank you. Have a good weekend.